How long does it take to heal without surgery after having an ACL tear? Well, there's a short and a long answer. And the short answer for you is going to be it takes anywhere from a couple of months, 2 months, to a year. And the reason for this is because it depends on the severity of the injury. You can have a partial tear, you can have a complete tear, and then you can also have an ACL injury with other parts of the knee affected, like the meniscus, the MCL, the LCL, the PCL. These are all other ligaments inside the knee. You can have problems with the patella and the ligaments that are below the patella and the ligament that's above, or the tendon that's above the patella. There's so many combinations of issues that can happen that can add more time to your healing after having an ACL tear. But for most medical professionals, what they're going to tell you is that it just takes a couple of months at most to heal. And what they're usually thinking about is the research that shows that ligaments heal within 3 to 5 weeks. Because the ACL is a ligament, it stands for anterior cruciate ligament, that's what ACL is. And an ACL can heal back together within weeks technically. But at that point, it is not usually strong enough to do everything that you want to do. It's just reconnected. And some medical professionals, many consider that as healed at that point. And some will say it's 80% healed, and that happens in the first month or two of healing after an injury. And then the last 20% can take months and months, maybe even a year. You have to consider what healing means for you. So this is the long answer now, is if you are going to get back to, let's just say the extreme, competitive sports again. Like let's say you're a professional athlete and you want to get back to playing high level contact sports like soccer or football, American football, that you're going to probably get somebody to fall into your leg, or there's going to be somebody that moves into your leg in a way that may re-injure your ACL, then you're probably looking at the longer time frame, like a year. Some people heal faster and can shorten it down to 9 months or less, but the average I've seen is about 12 months. In those first few weeks, the ACL is coming back together. That's the first phase of healing. But after that, what's necessary is tissue adaptation, meaning the ligament has to now, with scar tissue, that scar tissue has to get used to being pulled and tensioned as the knee is bending. So I have a knee model here. There's your ACL right there. And as you bend the knee, the ACL is designed to be tensioned during the bending part, during the middle of the bend, not straight, not all the way bent, but in that middle point, it's taking on some tension to keep the thigh bone connected to the shin bone as you do your movement, as you do whatever you're going to do, standing up, getting out of a chair, squatting with 500 pounds on your back, or sprinting and then turning and changing multiple directions. Your ACL has to be ready to take that. So you have to gradually add forces, gradually add movements to it so that it can take those movements without becoming more injured. And over time, as it rests, then it recovers a little bit stronger, and then you challenge it again, it rests and then it recovers and it gets a little bit stronger, and you have to keep challenging it slightly, incrementally more over time. As it adapts, then you can go into strengthening. You have to go into a phase where you add weights to your body and you do some weightlifting, for instance, or you are running and gradually adding more distance or more intensity. You're running faster. You have to take yourself through this process in order for your ACL to fully heal. Because what a medical professional says, it's healed within a few weeks, maybe a month, 2 or 3 months. It's not enough if you're a competitive athlete. If you take it to the extreme, you need to go through the adaptation process, which can take 2, 3, 4 months, and then you need to go through the strengthening process, and you have to determine how strong you need to be to get back to full speed activities without concern, worry, so that you can be confident in the activity that you love to do. So take that into consideration. On the short end, just to summarize, it's 2 months or less, because that's the ligament healing time frame. And on the long end, you're looking at several months, the better part of a year, maybe even a full year, to fully heal your ACL naturally without surgery. Hey friends, if this video was helpful for you, please give us a thumbs up. Please subscribe to our channel and turn on the notification bell so that you don't miss out on any helpful videos. I want to make sure that you get access to all our ACL videos. I talk about many different facets of the problem, how to heal it, which exercises to do. I give you tips and advice. I put all the videos in a playlist called the ACL Tear Help playlist. It's linked in the description below. Go check that out. Share that with a friend if you know somebody else that's suffering with an ACL problem. And also check out our ACL Tear Recovery Program. It's got my full treatment approach. I've comprehensively put it into the program. It's over 40 videos long of me walking you step by step as if you were a patient here in my clinic, and I was helping you recover from your ACL tear without surgery. There's a link for that in the description below. Thanks so much for watching, friends. I'll see you in the next video. Bye-bye.